Hello, Mr. McGrath, how are you?
Hi, how do you do, Dr. Ryan?
Come in and have a seat. My name's Breda Ryan. I'm one of the doctors in the surgery. I don't think we've met before.
No, I don't think so. It's lovely to meet you.
You too. What can we do for you today, Mr. McGrath?
Well, I was just having some funny symptoms over the last while. I was just getting a funny heartbeat.
Right.
I could feel it kind of in my chest. It was just kind of worrying me a little bit, so I said I better come in to see you and just get checked out about that.
Absolutely, great.
It's been kind of going on for the last 2 months now, but it's been kind of getting a little bit more frequent. You know, I was getting it maybe once every couple of weeks, but now I have it maybe, 3 or 4 times a week.
Right.
And it just feels, it kind of, when it comes on, it'll kind of grip you.
Right.
You kind of have to stop what you're doing. So it was just, it hadn't happened to me before. And my dad had a bit of trouble with his heart. So, I just wanted to make sure it wasn't something with the heart that I needed to look into at the moment.
Okay. Well, that's great that you've come in, because sometimes when people have these funny sensations in the heart or with their breathing, it can be a little bit scary. And as you said, your dad has a family history of heart disease. I'm just going to ask you, can you tell me a little bit more, John, about what you mean by a funny feeling in the heart, or what did it feel like?
I could really feel it beating in my chest.
Right.
It'd come on, it'd be running really fast. It's kind of quite powerful. I could feel it pounding in my chest, getting a little bit lightheaded when it was coming on. There was one time where I was out walking with my son, and we were going up quite a steep section of hill. I could feel this coming on, and then a little bit later I had quite a strong sensation, kind of a tightness in my chest.
Right.
And it was really powerful, and I had to sit down for a minute, really get my breath before we could get going again. And I found that obviously that happened last week, so I was quite worried about that. And instead of getting some dizziness with it as well, where I was just feeling a little bit lightheaded, like you would if you got stood up quite quickly.
Okay.
That was kind of what that felt like.
Okay. So just so I'm clear then, John, so you were getting these kind of fast heartbeats over the last kind of month or two, and they've been getting more frequent and a little bit stronger in the last couple of weeks.
Yeah.
And then last week you had the episode with your son where you got a pain in the chest.
Yeah.
Okay. And could I ask you, John, would you be able to tap out on the table what that fast heartbeat felt like? It's a hard question, but...
It was running... It was really, really fast.
Really fast.
That's, I think, the best way I could say it. It was like running.
Okay. And when you got that tightness in your chest, were you on the flat, or were you on a steep part of the hill, or...?
I was going up a steep bit of the hill, and I wouldn't be exercising too much at the moment.
Right.
So I wouldn't be very fit now, to be honest, doctor. But I still wouldn't have expected to get that.
And did the pain go anywhere? Did it go into your arm or into your jaw? Or were you very sweaty, John?
I was sweating a good bit because I was going up the hill, but I didn't think that brought out a lot of extra sweat. I had been working pretty hard.
And can I ask you, John, can you tell me a little bit, you mentioned your father there, is there any other family history of heart disease?
My brother had to get a bypass.
Oh, right, okay.
Bypass, I think it might have been three
a triple bypass, yeah.
He had one of those done.
And at what age was that?
I think he was 52 when he started having trouble with it.
And you yourself now, John,
I'm 48 now.
48, okay. And I just want to ask you a couple of more questions about your medical history, just about how things are at home, and then we might have a little look at the heart. Is that okay?
Oh, that'd be great.
John, have you ever been sick before, ever seen a specialist before?
No, never.
Never?
I don't come to the doctor too often. I've been lucky enough that way.
And is there any family history of thyroid disease?
No, not that I'm aware of. I haven't heard of that.
And have you ever been checked for diabetes?
No.
Or cholesterol? No. Or ever had any blood pressure problems?
No.
No. And are you a smoker, John?
I gave up smoking 10 years ago, but
Brilliant.
I used to probably smoke maybe about 20-25 a day before that.
Okay. So that's great. So you've given up 10 years ago. And do you drink much alcohol?
Probably not too much, but you know, I could have a couple of glasses of wine, probably most days.
Would that be 2 or 3, or would you be able to?
Probably 2. Might share a bottle with herself in the evenings. But that would usually, you know, we might go through, you know, a bottle between us, but it wouldn't really be any more. I wouldn't drink a bottle myself in the evening.
And at the weekends, would you have a few pints
I might
or
have a few
anything?
pints with the lads, and just maybe, you know, might have a gin and tonic or whiskey here and there.
Okay.
I wouldn't be going out drinking heavily around at the weekends.
Okay. But it sounds like you're having a little bit every day, and sometimes that can add up to a lot over the course of a week, you know?
Yeah.
So, John, I'm really glad you've come in today to talk about these symptoms, because it sounds like you were very worried after that episode on the hill.
Yeah,
and that's natural with your family history to be a little bit concerned. I just want to ask you, sometimes people get these kind of episodes when they're very stressed out or very anxious. They get this feeling of a flutter in their chest. Could you relate to that at the moment, or are things going well for you?
Well, you know, things are going well in the business. You know,
Good.
We would be always under a good bit of pressure.
Yeah.
Just, you know, we'd be very busy, but it wouldn't be any more pressure now than any other time. We don't really have any, you know, financial concerns. The kids are grown up a little bit now, so they're in their teens. So, you know, I don't think I'm under any extra pressure at the moment.
Good. I think, John, what we might do next is examine you, take a look at your blood pressure, your heart, your chest, and just see if we can find anything on examination today. Is that okay?
So blood pressure is 152 and 95, heart rate 68, regular. The rest of the examination is normal.
Okay. So, John, the blood pressure is a little bit up today, but that's only a one-off reading. What we usually do in that circumstance is put a monitor on the arm called a 24-hour blood pressure monitor. We get you to wear it at home, and that gives us an idea of your average blood pressure over the course of the day. Okay. Is that okay? I would like to arrange some tests for you, okay? We do need to do some blood tests because we haven't done any before for you for diabetes and cholesterol and the thyroid, okay? And you know, it's reassuring today that when we listen to the heart and we check the pulse that that's all normal. But that's really only giving us a snapshot of what's going on right now. And as you were saying, these episodes are coming and going. So we really want to get a clearer look at the heart, or a more detailed look at the heart. So
that sounds good.
Yeah, what we can do is we'll ask our nurse to do an ECG today, which is an electrical tracing of the heart. We'll have a quick look at that. But really what we'd need to do is get a Holter monitor for you, which is a 48-hour monitor of the heart, or sometimes we need to do a 5-day monitor of the heart. As well, now this episode that you had with the chest pain going up the hill, that's a little bit concerning, especially with your family history, and it's definitely worth looking into that a bit more. So there's a good test called a stress test, where the patients go on a treadmill, we put the heart under a little bit of pressure, but you're supervised by a nurse in the hospital, and there'll be a doctor there as well.
I think my brother had one of those.
Yeah, your brother probably had that done, and that'll give us an idea of whether the heart is under pressure or not when you're exercising. And I think when we have all that information back, we need to then decide whether you need to see a cardiologist or not. Okay? Some of the blood tests that we do will look for your cholesterol, diabetes, and we can manage all of that here in the surgery, and we can manage your blood pressure. But with regard to this chest pain that you're having, we're probably going to have to get that checked out in the hospital.
Okay.
You don't need to go to the hospital today, but we need to get you checked out as an outpatient.
I'm probably going to be heading away in a couple of weeks over to Hong Kong for business.
Okay.
Would it be okay to get say we can get the ECG obviously today and the bloods?
Yeah.
Would it be okay to do the other ones maybe after I come back?
Well, ideally I'd like to get them done sooner rather than later. Just because that episode you had did sound a bit frightening, you know, when you were going up the hill and it stopped you in your tracks.
I'll probably be taking it, you know, I won't be doing anything.
You won't be doing anything major.
Yeah.
Well, what I could do is I could ring the clinic and see if they could fit you in the next week.
Right,
and try, yeah. I think it'd be great if we could get this done before you go. It'd give you a little bit of peace of mind going off on your trip, and then we could follow up when you get back.
And do you think, you know, is there a chance that I could need a bypass like my brother?
I think that I can understand why that question has crossed your mind. You know, obviously I don't know your brother and I don't know his history, but I suppose what I am concerned is there a small bit of angina present? And what angina is when the heart gets a little bit deprived of oxygen, and that gives us chest pain. So Really, it's too early to say, but I think the best thing is to look into it, and you know, we'll do our best for you, and we'll get you seen by a heart specialist if there's any concerns on any of the tests.
I really appreciate that, Doctor.
No problem.
You've put my mind at ease an awful lot today. Thank you.
Good. Have you any questions?
No, I think you've covered pretty much everything there that I wanted to know. So
Well, let's get the ball rolling with the tests.
we'll get the ECG today.
Yeah, I'll ring you with the results of the blood tests, and we'll arrange the stress test, and then we'll follow up here with you afterwards before you go to Hong Kong.
Yeah, no, that's fantastic. Thanks a million.
No problem. Nice to
Lovely
meet you.
see you. Thanks a
Take
million,
care.
Dr. Ryan. Appreciate it.